If knee pain is affecting your quality of life, it doesn't have to. We're in the offices right now of Dr. Jeff Hodrick, who's with Southern Joint Replacement Institute. We're going to talk about some of the options for folks who have knee pain. Such a terrible problem because it really does affect your quality of life.
And there's no doubt about it. I think knee arthritis especially is becoming more and more common as we look at the projections of who it's going to affect in the coming years. The numbers are really astronomical. And I think the difference is, what do you do about it? What are the options for that? I think it's not acceptable anymore to really live with pain and have your activity limited by pain. I think arthroplasty is a great option for a lot of different patients.
All right, we've got a knee who's affected right here by arthritis. Tell us what we're seeing here.
Sure. So these are two x-rays of knees. Obviously, everything that you see that has calcium in it is bone, so the thigh bone and then the shin bone. In between is a space that is usually cartilage. So on this side of the knee, you can see there's a well-preserved space or cartilage, and on the other side, you can see how that's become thin. And that's arthritis, and that's what causes the pain, the swelling.
So those bones are grinding together then as you're walking.
That's where the rubber hits the road, or however you want to say it, bone-on-bone type arthritis. You can see some bone spurs over here as well.
So when you have a situation like that, what are your treatment options?
Basically when that bone starts rubbing on bone, there's not many. Certainly you can try medications for as long as you can stand it, but the tried and true method of treating this type of arthritis is with a knee replacement.
And you don't have to wait until you're 70 years old to get it.
No, I think that was the predominant thought years ago, that you had to wait as long as possible and live with the pain and limp and get a cane and everything else. But I think people are not accepting that anymore. If you want to have an active lifestyle and get back to doing the things you want to do, I think knee replacement's a great option.
So what does a knee replacement look like? You've actually got the apparatus right here.
Yeah, we do. We have a model here of what it looks like, and it is metal and plastic, so it's not really a replacement as you think of. It's actually a recapping or resurfacing of the femur bone, and there's metal on each side, and then there's a plastic insert in the middle. This specific model actually allows a little bit more movement in that interface as well. So then that allows for
flexibility then.
Absolutely.
What I think is interesting too is I'm hearing about gender-specific knees or knees of different sizes.
Yeah, I think technology is another way that we're providing more options, I think, for patients. Everybody's built a little bit differently. I think there's a good example of kind of what we call the gender knee, and there's male and female options. And essentially, it provides more sizes. Not everybody's the same size this way as they are this way. So you can see here how the metal fits onto the metal, onto the end of the bone, and provides that gliding surface on the plastic. So there's certainly a lot of different sizing options that we're calling the gender knee.
What's the lifespan of a knee replacement?
Well, there's a lot of studies. We've been doing it about the same way for close to 20 years, and there's good numbers that support close to 85 to 90% survival at 20 years. So this isn't something that years ago was thought to last 5 and 10 years. I mean, there's a good chance of having a knee replacement and lasting 20 plus years.
Wow.
So I think that's really encouraging even for younger folks.
And most people get full mobility?
That's the idea, yeah, to get them back and have the full mobility that they had before, and mostly just getting back to the activities that they could do before. And a lot of that has to do around work, and then also around play, family time, spending time with children, grandchildren, and just keeping up.
Yeah, getting that quality of life back. It's so important. Dr. Hodrick, thanks so much.
Thank you.
Appreciate it. If you'd like to find out more, we're going to put information about the Southern Joint Replacement Institute on our Talk of the Town hotline, and we'll link our website to their website as well.